I'm Nicole Griffrath. This is for NUR 435. I'm going to be doing trach care and suctioning. So before I go in the room, I'm going to see when she got her trach placed, the last time I got suction, if there was anything that I needed to know that was documented. I'm going to knock on the door, patient privacy, hand hygiene. Hi, I'm Nicole. I'm going to be your nurse today. I'm going to be doing suctioning and trach care. So I'm going to elevate the bed to the height that I need it at. I'm gonna put her at semi-Fowlers to Fowlers. Can you state your name and date of birth? All right. So before I start, I'm going to get her a heart rate. I'm gonna assess her respiratory status, the depth, rate, rhythm. I'm gonna look at the secretions, if there's any visible ones, look at the incision site. I'm going to make sure the obturator is at the bedside and that there is an extra trach tube, just in case, for instance, the tube that is in would fall out or come out for some reason. You never know. So I'm going to hyperoxygenate the patient for now. I put this down just in case any secretions or anything comes off. I'm going to hyperoxygenate her, and I'm also going to turn the suction on between 80 and 120. I'm going to make sure that it's working, and it is. All right, so for the sake of this video, I'm just going to put this down. I would have the patient hold it if they could. I'm just going to put it down there like that. All right, and whenever I start this, Pearl, if you have any issues or just need to catch your breath or just need a second, just raise your right hand, and I'll give you a break. Great. So I'm going to do hand hygiene. Now I'm going to get my suction kit ready. I'm going to put this. Alright, obviously if I needed to, I would get a new set since that kind of touched the side. Alright, so I'm going to grab this, set this up. I put sterile water in there. I'm going to grab the suction thing. Like I said, if that was falling over, I would get a new one. I'm going to throw that down, throw it away. Alright, so now I'm going to have one dirty hand and one clean hand. I'm going to attach this. I'm going to test the suction, make sure it's working. It is. So I'm going to do intermittent suction. I'm going to put it down on the trach, and whenever I hit resistance, I'm going to pull up to 2 inches, and then I'm going to suction intermittently as I come out for 10 seconds. So, down. Hit resistance, and then I'm going to go up 2 inches and then suction intermittently for 10 seconds. I would ask the patient if they feel like they need more suctioning. If not, then if they did, I would wait 2 to 3 minutes and then I would do it again. But in this instant, they don't need it, so I'm going to take that unattached, pull that out, and I'm going to throw all of this away. I'm going to make sure they're doing okay throughout the whole suctioning and throughout the trach care. I'm going to throw this away. I'm going to do hand hygiene. I'm going to let them know that I'm about to do trach care now and clean. So I would take this out. Hand hygiene. I'm going to put my sterile gloves on. If it rolled, I would get a new glove as well. Alright, so I'm going to take this, set up my sterile field. The 1 inch margin is non-sterile, so I just need to be aware of that. Pull that out. Pull that out. Alright, so I'm going to get everything set up. I'm going to take these pink chips out. I'm going to leave this in here. So I'm going to open the peroxide, the hydrogen peroxide, open it up, pour it in there. And then I'm going to take this, the sterile water, and pour half in here and half in there. And now I'm going to have a non-dominant and a dominant hand. So it's going to be my dirty hand. With my dirty hand, I'm going to grab the trach out. I would always assess, make sure they're still doing okay. I'm going to hold it and clean it, but make sure I'm above this little tray so I'm not contaminating the rest of my sterile field. Make sure you're cleaning it really good. And then I would drop that in there. And then I would take it out. And I would drop it in here for a second. And then I'm gonna move it up. Alright, are you doing okay? Alright. So then after that, I could take, I would take my gloves off, and then, because now they are soiled, and I would put a new pair of sterile gloves on. I would do hand hygiene. So I had taken that little gauze that was up there, and I would, if I need, I already taken it off, so if I needed to, I would clean it, and I would take, like I said, I have new sterile gloves on. I would take a little 4x4 and clean around it if I needed to. And then I would let it dry, and I would make sure it's dry because I don't want to have skin breakdown or anything like that. And then I would take another one and I would put it back to where it was, or put another one, a clean one on there. I would have maybe another nurse come and help me because this can be a little bit tricky because you want to make sure it stays pretty clean and sterile around there. So I put that back on, and it would be a little easier on a real person because they can hyper extend their neck and like help me, and their neck can move, unlike these dolls. So I would try to stay as sterile as possible when putting this in. And like I said, I could have a partner if I needed. For the sake of the video, I'm just gonna act like I got it in there, but make sure you try to stay as sterile as possible. And I would change the collar if it is soiled, but if not, in the sake of this video, it's not soiled, so I'm not gonna have to replace it. But like I said, just make sure you have someone to do it with you. And whenever I'm done, I would document any drainage that came out. If the patient had any issues, I would put the oxygen back on. I would put the oxygen also back down to what it was the previous setting before I started hyperoxygenating the patient. I would turn the suction off, and I would just document any relevant data. I would make sure I checked my safety checks and the call lights in reach. I would lower the bed again. And that's it.